Welcome again. I did promise you I was going to follow up when anxiety becomes a disorder. And that's the time when you're diagnosed. And that's the time if you're not diagnosed and you hear any of these symptoms, it means that you need to go and see your psychiatrist or your local doctor who will let you know you probably need a specialist, right? Not all anxieties are disorders, yeah? But the first one I'm going to mention to you is the generalized anxiety disorder, which is called a GAD. So when you hear GAD, you're talking about the generalized anxiety disorder. And people with GAD feel excessive anxiety. This may last for like 6 months. And if it's going for 6 months, you know it is really serious. Yeah? They may feel restless, on edge, easily tired. Sometimes you're tired and think, oh, I'm drained. You've got to check the list to see, if it comes under the GAD. They may also experience concentration problems. They cannot concentrate on anything. Irritability, muscle tension, or deprivation of sleep. You can't sleep no matter how you try. You cannot sleep. Okay? So that one is called the GAD. Thank you. Then we have panic disorder. And a lot of people suffer from panic disorder. People with panic disorder experience panic attacks. You've heard about panic attacks. These are sudden feelings of terror. And you're terrified when there's no danger present. It's not like there's something that's threatening you. No. You can just wake up and feel this kind of panic. You might have a bad dream, or it might not even be a dream. You might just wake up sweating. Physical symptoms include fast heartbeat. Your heart is just beating, you cannot control it. Even taking deep breaths, but it's just going. It's like it's pounding in your head. Chest or stomach pain. Breathing becomes very difficult. People may also feel weakness or dizziness. Sweating, chills, numb hands. It may even feel like having a heart attack. It's more common in women than in men. I don't know why. Obsessive compulsive disorder. You may experience frequent obsession for germs, have a fear for getting hurt, wanting to arrange things in a certain way. Can you imagine that can be a disorder? Yes. It has to be this way or no way at all. And if somebody should change something around, everything for them becomes a ritual. It must be this way. Don't change how I have it. I like it this way. I can find it when it is in this order. Yeah? And for example, somebody who is worried that their house may be vandalized. This person might not even go outside. They keep the doors locked and they lock every door and bolts and everything, and fear to go outside lest if they go out something should happen. So this is what you call OCD. Everything is a germ. Everything is a germ. Everything, if there's a little crumbs on the ground, it's a germ. Oh my God, there's crumbs on the ground. And don't imagine that those people don't need to see bugs. Because if they see bugs, it's really, really out of it. And most of the time, this diagnosis runs in the family. So it can be hereditary. Yes. Phobia disorders. Phobia is an intense fear or aversion to specific objects or situations. This fear is out of proportion to actually danger caused by situation or object. People with a phobia may experience irrational worry. Because guess what? You're fearing something that is not even there. Yeah? They may also experience immediate anxiety upon encountering the feared object situation. Common phobia include flying, heights, animals, and injections. That can be a phobia too. Being in the elevator. Yeah? Some people begin to hyperventilate if they should go into an elevator. Some people don't take the elevator any at all because they start to fear, what if the elevator stop working? Wow, the phobias that are out there. And then you have post-traumatic disorder, PTSD, and we hear about this all the time. PTSD occurs in people who have lived through or seen traumatic event. These events may include war. I'm just so sorry for those soldiers, especially those soldiers who have been at war. And I can tell you about it. I've experienced it. I actually married a man who was in the army. He was there for many years. Well, and he was such a nice sweetheart and everything when we got married. And he's a Christian, so don't believe because you're a Christian you don't suffer from stuff like these, especially if you don't want to get it treated. So my husband would be a sweetheart now, and the next moment without anything at all happen, he just changed like what they call it, Eckle and Hyde or whatever. Yes, he just changed on me. And the worst thing about it is that I say, honey, you need to go and see your specialist. Something is wrong, you're behaving. I know what was the situation, but I didn't want to name anything for him because I know that I know it was PTSD, and he would get mad if you say he has something. I don't have this. I tried to help him. We stayed together for 5 years. After that 5 years, it becomes very, very difficult. I couldn't do it anymore. And because what he became abusive. One time he attacked me in my sleep. If I say something that he disagrees with, he'll want to come at my throat. And I'm so happy that God made me strong, so I have to push him away and say, I'm not doing this. I didn't marry for this. And when he's nice, he's nice. But when that thing takes you, it's like a demon. And when he came at me once, when I was sleeping, I knew this was it. I said, I'm not doing it again. Sometimes I want to try to fight me like I'm in the war with him. So I said, I'm not doing this. I do not encourage anyone, no matter what the sickness or something somebody going through, to suffer abuse from any situation. As a counselor, if there's abuse, I advise you to run and seek help. Don't sit and pray, okay, God will take care of this. Okay, Lord, I'm asking you to take care of this. This person is sick and this person needs medication. And if they're not on this medication, I'm just saying, share with you so you understand that I know what it is to have PTSD. And I advise, if you're a soldier out there, if you are a father, if you're a husband, if you're just a son, whoever you are, we're grateful that you went to the war and you fight to see all these things happening around you. However, if you discover that these symptoms you have, go, and many people have been actually been counseled from the army and they were sent to specialists, but they don't continue this thing. And so as a result, if you're not healed and you don't continue, you're going to be in problem. So I just want to take time out to share that with you. And sometimes you have trouble sleeping at nights. And I can tell you about my husband again. He would kick and toss and fling his feet all over on the floor and everything. And sometimes I touch him and say, honey, what's going on? You could see he was going through some nightmare and something happening. But it was scary. It was very, very scary. Scary to watch. Yeah? And then you wonder, man, when am I going to be the victim? And then that is my first place where I started to recognize that I had anxiety. Because I was sleeping as I should. I started looking around to see as a movement is made, I'm ready to jump off the other side of that bed. So I know what it is like. And I'm not ashamed of telling you my story. Nightmares. Oh my God. PTSD comes with a lot of nightmares. Lonely feelings, angry feelings. Oh my God. My husband was so angry. When he's nice, I tell you, hey honey, and he's nice, but you don't know when he's going to change. Then the slightest of trigger, anything that he sees around that trigger, it could be a scent, maybe he smells something like when he was in the army, this was something that happened and he smells this and it triggers him. It could be food that he maybe ate or want to eat or something, but anything that triggers him and he just go up through the roof. So I don't know when to anticipate that change. I don't know when he would change. So that was not a good situation. These people who have PTSD feel lonely. They have outbursts all the time. They just outburst for nothing at all. And sometimes you judge people like these. But there's no need in judging them. It is a mental health sickness. And what they need to do is to get a psychiatrist and to get on their medication. We should not put a stigma on this. We should not try to belittle somebody as a result. Of course, if you need help, you need to run and get the help that you need. People with PTSD may feel worried, guilty, or sad. Check yourself. See if any of these disorders that I've mentioned that you can identify with. And if you can identify, get yourself diagnosed. Don't be a danger to yourself and don't be a danger to others. Everybody deserves happiness. Everybody deserves joy. Everybody deserves peace. And can I make a note to the families? Kudos to you who have been coping with people who are mentally ill in your home. However, if you feel like you're endangered, please remember to seek help and to find help for your loved ones. Some of them might have to be removed from the homes in order to be helped. And that's why, well, like in the US, you have personal care homes and homes that there can be, restricted and operate and get their medication until they're better. Oftentimes when they are better, they can rejoin the family because they are different persons. Always say to my mentally ill folks, mental illness is just a breakdown of a chemical breakdown. It's just like one side of your brain that might be affected, but you're good. You can still work, you can still be a person, you can still be in your community doing something that's purposeful. So, hope this has been useful to you. Until next time, I'll see you again and we'll talk more about this thing. Because guess what? Mental health is a serious thing and we need to recognize that people who are mentally ill need help. They need help. And this is where I say, don't take it for granted and laugh at these people or throw them to the roadside, put them on the road so they become homeless because they have been acting a certain way. Find help for them. I've seen many recovered. I've seen many being married. I've seen many just say, I can go on my own now and being on their own and doing well. So it's not over until it's over. Let's show them some love. God bless you. Walk good. Bye-bye.